an anthropologist looks at the complexity of an illness as experienced by an individual within their social network and within their larger social context, whether that's the local context of the clinic, their home, their workplace, and also their larger transnational community. One of the things I find really exciting about thinking about breast cancer risk across the lifespan in the context of immigration is really looking at the effects of not only where people grew up and the potential exposures at different points of susceptibility, but also the continued connections that they maintain with their communities of origin. So, for example, Latinas living in Marin are experiencing current day exposures through workplace or through their changes in diet, things like that. But they're also maintaining connections with their home communities. And those connections are not only influencing their lives in Marin, but also influencing the communities from which they came.
As a research associate, I think my role is to be a listener. So when I approach them in hospitals or when I go to their home, which I often do, I am there to say, I want to hear what you have to say. We can't do this without you. And they see that we appreciate them being part of the research study, and they see that we're humble. And I'm there to be kind of the bridge between the investigator team and them. And I'm the one bringing their voice in a way to the investigator team. The work that Zero Breast Cancer have done and is doing with teens in general in Marin County and with Latina teens in particular, it's very important because as we know, in immigrant families, children and teenagers are the ones who are kind of the bridge between the outside world and the house, and they are the ones who have access to health information, and they are the ones who bring this information to home. When I was part of the project, we work on the outreach working in modifiable environmental factors that are associated with breast cancer. The teens were very responsive. They say that they want to do things for their own health, but they also want to bring this information home, and they want to share this information with their friends. So in that sense, I think it's very valuable.
When I learned of our selection as the community researcher team, I was surprised and very pleased. It means a great deal to me. I've learned so much from working with Zero Breast Cancer over the last, 5 years, participating in the community education forums, working together to develop a research program. Zero Breast Cancer has worked to redefine the questions that are asked in research. And I think that's where there's a real synergy between the goals of your organization and what medical anthropologists do.
Being selected for this recognition, it means a lot to me personally. I feel that I owe this to the women and men that I have worked with over the years, especially doing research during these past few years. They have opened their minds, they have opened their hearts, they have opened their families and their homes for us to go and ask questions and learn from them. And we cannot do our job without them. So this recognition is and my gratitude is to all of them, and of course it's to Zero Breast Cancer for seeing the work that we do here at UCSF.